Hello again and welcome to Health Matters. I am Mary Alale Yusuf. How can 14 people die every hour from a disease that has a vaccine? According to the World Health Organization statistics, which was updated in February 2014, that is exactly what happens in the case of measles. Yet, according to these same statistics, vaccinations caused a 78% reduction in measles deaths worldwide between 2000 and 2012. Measles is a highly contagious respiratory disease occurring more commonly in developing countries and in children below the age of 5. Now, it appears we are winning the war against measles, but can we do more to get rid of it? Joining me on the program is Dr. Femi Akodu, a pediatrician from the Lagos State University Teaching Hospital. Thanks for coming, Dr. Akodu. It's nice to have you on.
Thank you very much.
Now, the one thing that baffles me, and maybe some others, is what's the difference between contagious and infectious? Are they the same thing?
Well, literally to the layperson, the two could mean the same, and even in the medical world too, they are used interchangeably. By being infectious or being contagious means that someone can acquire an infectious agent, and as I said, interchangeably people tend to use the two
terms.
Yeah.
Okay, so this now means that you can contact it by touching somebody who has the disease or the problem, or if the person sneezes, or if you're in close proximity with the person. Isn't that the meaning?
Well, if we use the disease which we are actually talking about this afternoon as an example, it can be transmitted via inhalation of infected droplet from an infected individual or by contact with an infected individual. So the people tend to restrict contagious to some infections that are either acquired through droplet infections. But because when you talk of infection, you need an agent. There needs to be a medium through which it will be transmitted to a new host.
Okay, but measles is not like that, is it? Does it have an intermediary?
No. The medium through which it's transmitted is not an intermediary.
Okay.
In some situations, yes, there is an intermediary. But like in the measles, what you have is that there is an agent, which is the virus, that has to be transmitted to a new host, which is that new individual with the infection.
Okay.
So in the case of measles, man is the only reservoir.
Aha. It doesn't go through animals.
No. Which is even one of the beautiful things that makes measles to equally be possible to be eradicated, just as we are doing for polio and just as we have done for smallpox, because there is no other vector, there is no human vector that is required. It's only in human that you find it.
So what are the symptoms of measles and how do they progress?
Well, I think we should start first with the progression. Once a child is exposed to the virus, it takes about 10 to 14 days for the virus to undergo a phase which we refer to as the incubation period. That is, the virus is within that individual replicating, but there are no signs or symptoms of the
silent.
Exactly. So the incubation period is about average of 10 to 14 days, after which there is another phase which we call the prodromal phase, in which the symptoms that is actually noted for measles is not yet developed. And the common symptoms we tend to see at that prodrome phase are fever, the child has malaise, might not be feeding well, and then there is cough, there is catarrh, then the eyes are red and having a watery discharge. And in the extreme, the child might even be feeling pains when it looks at light, which we call in the medical terms photophobia.
Photophobia.
So, and this prodromal phase lasts about 3 to 5 days.
So so far we've talked about 13 days now.
Exactly. So after that 3 to 5 days of that prodromal symptoms, then the characteristic skin rash now erupted. And the eruption...
It's at this point that people say, perhaps he has measles. Okay.
And that, again, is about the time that people now start thinking that the disease is infectious. Okay. But that was wrong.
That's where I was coming to. At what stage is it actually infectious? When do people catch it?
So let me let you know this fact. Measles, that is what we call a secondary attack rate. The secondary attack rate of measles is 100%. That is, if you put a child that has measles and ask other children to come in close contact with the child, all the children that comes in contact with that child will end up, unless if they are protected,
having measles.
Exactly. So which is why the secondary attack rate is put at 100%. Okay. The period from which the condition is actually highly infectious starts from 7 days after the child had been exposed to the virus, up to about 2-3 days after the eruption of the skin. Okay. So you will have seen that large chunk of the period when this child was infectious,
nobody knew there was a problem. So he could just be sitting innocently by and people would be catching it around him.
Exactly.
Okay, if that's the case, where does the issue of quarantine come in?
The quarantine now will now come in about the time that you now see. Don't forget that when you quarantine is like somebody that has been exposed, and you are now isolating that fellow and keeping a watch.
But in this case, you don't know who's been exposed because nothing is
showing
up.
But eventually, that child that will first of all thought maybe he had ordinary flu, until by the time the rash now erupted. So all we have to do is just to trace our mind back to those that had, children that had contact
with him several days before.
Keep a surveillance on those children.
All right. So it's like, maybe the teacher sends a note to the parent, watch your child.
Exactly.
We had a breakout of measles, and these are the children who have been around him. So just keep a lookout. But
perhaps if, you say that is why the place of immunization, actually, because that secondary attack rate, as I said, that is 100, is only applicable to children that are not immunized.
Yes.
So for those that were immunized,
they don't have a problem.
But again, that we have another category of children. Don't forget that there are some children either for some inherited disorders or for some acquired problem, the immunity is low.
Okay, we'll come to that, but let me ask you about the rash. When the rash comes out, is it a peculiar type of rash? Is it something recognizable, or is just a rash and nobody is sure what type of rash it is?
I think it's a very good question because most mothers tend to get confused when they see skin rash on their child. In terms of the progression and then the disappearance of the rash, and in terms of the location and spread,
it's significant.
Exactly. So one of the telltale signs that yes, this child has measles, if the child had all the prodromal symptoms that I've talked about, and 3 to 5 days later, the child has having skin eruptions that most of the time start behind the ear, progress to the face, spread to the neck, to the extremities, then to the trunks, and then from there to the leg. And one good thing about the rash also is that the rash is a mixture of two type of skin eruptions.
Okay. Are we seeing those two types of eruptions?
If you see, you will see that there are some that are kind of raised, and you see some area where there are no raised skin rash, but there